Dr. John Lewis, thanks for joining me. How you doing, buddy?
Carl, thanks for having me. I'm doing great. How about you? Are you staying warm up there?
No.
No. Come down to Miami.
Yeah, it's a heat wave. It's actually a heat wave here. It's up to about 34 today.
Oh, wow.
When I woke up yesterday, it was -8
Oh, my
here
gosh.
in Syracuse, New York. And
Oof.
it's funny, I just came back from a 15-day trip to Mexico where I set up a clinic, a neuromotor training clinic, and I was out for 11 days before that in January. And then I did go, I tailed the end of that trip was in Orlando. So I mean that was kind of nice too for a couple
Yes.
days. So anyways, I first of all for people listening, we've had Dr. Lewis on the show before. He's become a friend. He's somebody I met through a mutual connection, Eric Durek out in
Yes.
California. Thank you, Eric, if you see
Thank
this.
you, Eric.
And I think this summer is going on 3 years that I've been taking the Dr. Lewis Daily Brain Care Formula. And we're going to talk about this today in multiple ways. We've talked about it before on the show, but I just want to say, first of all, as I told you off camera, this is the only ever supplement we've sold here. It's the only one we sell, and that's it. Because this does so much for the brain and for the body. And then we get talking about things like TH1 and TH2 with inflammation and you know all your research you've done in so many different arenas and you've been published so many times and you even go on down the path of multiple sclerosis and benefits to multiple sclerosis that this brain formula has. um you know, we're going to be introducing this to Mexico very soon, so get ready, Mexico, because eso estaré
Coming.
contigo pronto. And it's going to be
Yes.
muy importante por tu cerebro, for your brain, so in your body, tu cuerpo. So um, let's start off with this TH1, TH2 thing. And can you
Yes.
dial back? First of all, what is TH1 and what is a TH2? And then the significance of these.
Well, again, thank you, Carl, for having me. And as I said offline as well, I'm just so flattered and grateful for your support and selling daily brain care in your clinic and helping your clients. So that means the world to me. I really appreciate it beyond words. So I never take any of that for granted. I'm so grateful for that.
My
Um,
pleasure.
and daily brain care, for those of you who maybe have not heard you and I speak before, listening for the first time, daily brain care is the culmination of what I think is the most significant part of my life's work. All those research, all of those years that I spent at the University of Miami Miller School of Medicine running clinical trials, the studies that we ran looking at these polysaccharides from aloe vera and rice bran that led to the creation of daily brain care, just beyond measure compared to the other work that I did in terms of being able to help people. So with that said, after running the Alzheimer's and multiple sclerosis trials and creating daily brain care, leaving academics, I still have a very scientific orientation to my business, even though I'm not in academics full time anymore. I still have a voluntary appointment with the university, but I'm really focused on building the Dr. Lewis Nutrition brand, including daily brain care. So it is important, again, to have not more than, I mean, not only just a nod to my scientific background, but to continue as much as I can evolving as a company with a scientific base. So, with that said, my colleagues and I published a couple of papers looking at this TH1 to TH2 ratio in both patient populations. TH1 to TH2 is an interesting paradigm in terms of looking at balance within the immune system.
Mhm.
So on the TH1 side, you have what's referred to as pro-inflammation. And then on the TH2 side, you have what is referred to as anti-inflammation.
Mhm.
Let's talk about the word inflammation just for a bit before I continue down that TH1, TH2 paradigm. So, as you know, treating people who come in with all different sorts of conditions neurologically, if you've been involved in an auto accident or some other type of maybe work-related accident, vacation, whatever, or if you've had an infection from bacteria or fungus or whatever, your body responds to that in very specific ways, and it needs inflammation at that moment.
Hmm.
So a lot of times we throw around the word inflammation, really meaning the chronic type related to all these chronic diseases we're dealing with today. But in reality, we actually need inflammation acutely when we're dealing with something that requires our body to say, hey, we have damage, or hey, we're being invaded. We need to do something about it. So I'd just like folks to remember that there are actually two very distinct types of inflammation: the acute type that we need to help us recover from something in that moment or in that short period of time. But then that chronic type, that's the one that unfortunately gets dysregulated and out of control and then leads to all these other things like Parkinson's and Alzheimer's and MS and diabetes and cancer and heart disease and the whole list of things that is now killing us today. But just keep that in mind that there are actually two different types of inflammation. And so when you recover from something acutely, ideally, if your immune system is functioning properly, the anti-inflammatory signals take over from the pro-inflammatory signals to calm down your immune system, to shut off all of that programming or that repair, and then kind of go back to a normal status or baseline or homeostasis. So in the Th1 to Th2 paradigm, you have this balance going on all the time. And so, actually, this paradigm goes all the way back to a paper in 1986 where people were looking at trying to better explain the ravages that HIV was doing to people at that time, way prior to the advent of antiretroviral medication. And so they looked at the Th1 to Th2 ratio in a mouse model of HIV to try to better help explain it. Now, it is sort of a gross oversimplification. The immune system is way more sophisticated than just this simple ratio, if you will, but nonetheless, it's a really nice clinical indicator that we could use at any moment in time to say, Carl, John, how balanced is your immune system from this Th1 to Th2 perspective?
Hmm.
So when we initially wrote the paper from the Alzheimer's study first, and one of the things that I like to do, and you mentioned me being very published, I think I'm somewhere between 180 and 190
Yeah.
peer-reviewed publications in my career. The thing that I like to do initially when I'm thinking about a new idea for a paper is I go to PubMed and I do my homework. I do a literature search, I see what's been published and see what's already out there, and then I can use that as either a comparison or a contrast to what maybe my data show. In the case of the Alzheimer's study, it turned out that we were actually the first people to ever publish to even characterize the Th1 to Th2 ratio in people with Alzheimer's disease. And that was pretty exciting because, when you stumble upon something like that and you can claim to be the first people to recognize and characterize and actually describe that phenomenon in a patient population, that's a pretty cool thing. It's not necessarily going to win you the Nobel Prize or anything, but at least in terms of being able to make that claim is pretty cool as a scientist. And like
Absolutely.
and likewise, in the MS study in that population, there had been some other work looking at the Th1 to Th2 ratio in people with MS, but it really didn't have anything to do with our design, our purpose of evaluating a dietary supplement formula, and then looking at the changes in the Th1 to Th2 ratio over a 12-month period. So
Hmm.
again, ours was the first from that perspective, even though it had been characterized in a couple of other articles prior to ours. And so, interestingly enough, as you well know, treating these kinds of folks every day, you have neurodegeneration is more, I would say, classically associated with Alzheimer's and Parkinson's. But then MS is a little bit of a different animal. It's kind of this hybrid of neurodegeneration plus this immune dysfunction. It's really, in my view of it, a much more of a hybrid disease compared to the other two.
Hmm.
So we, in addition to those two patient groups, we also had a subject, a study of healthy subjects where we collected the exact same inflammatory markers to be able to compare this Th1 to Th2 ratio among these three different groups. And so in the first paper, in the Alzheimer's paper, you have this dramatic difference between the two groups. We actually calculated six ratios. We had this whole battery of cytokines and growth factors that are these inflammatory markers that people look at. And so in the Alzheimer's study, the Alzheimer's patients were highly, highly Th1 dominant.
Mm,
So their pro-inflammation was just off the chart.
mhm.
And then you look at the healthy group, and all their values, all six of their values are very close to one. They're not exactly one, but they're relatively balanced. So it makes sense that those folks are, they don't have neurodegeneration, they don't have infection, they don't have diabetes, cancer, heart disease, any of these other things. So that was a very interesting, like looking at the data, like, wow, like what a stark difference. And then over the 12 months, in response to taking what we now call daily brain care, five of the six of those ratios got less Th1 dominant. They didn't return anywhere close to like 1.0 or unity, but they at least got, more, I like to refer to it as less Th1 dominant.
Okay.
And then the really cool clinical finding in relationship to that rebalancing effect was that as they got more balanced, as they got less Th1 dominant, cognitive functioning increased. So that was really cool to and again, for those of you who've listened to our previous conversations, you know that we published a whole host of different findings in both of these studies, but especially in the Alzheimer's study where we looked at these dramatic changes in improvement in cognitive functioning in response to our product. That was just a really nice practical or clinical side to the equation of looking at the link between brain health or cognitive function and then what's going on at the immune system level. And then also, I think it's important again because I'm pretty sure I mentioned this previously, but I want people to understand that the immune system is much more than our first line of defense against infection. Whereas that is a very well-known and obvious job that it has for us, there's another very important job that most people are unaware of, and I like to use the analogy of the symphony orchestra. In the orchestra, you have all the different sections of music, of instruments, right? They're playing the music, and then you have the conductor in the front waving his little stick or whatever that thing's called, and he's keeping or she keeping the orchestra in balance and playing the music and keeping everything the way it's supposed to be running, essentially in harmony or balance. I like to refer to the immune system as the conductor of the symphony orchestra. It's communicating with all the other major organ systems, including our central nervous system and our brain, to keep everything else in balance. And so this is where the immune system's role, its job is so important because if you don't have a properly regulated, surveillant, modulated immune system, you cannot possibly expect all the other major organ systems to be doing their job to the same degree of optimization. So that's a very, very important role that most people just are completely unaware of in terms of what the immune system does. So again, if you look at the entire body of research, the entire body of work, just on the Alzheimer's study alone, and we'll talk about the MS study in a minute, but we show again and again through this series of these four papers the links between brain health or cognitive function. Brain health is kind of like assessing cognitive function is like a proxy measure of brain health. There's no, I mean, unless you're looking at, EEGs or CT scans of the brain, I mean, to me, I don't know how you feel about it. Brain health, is kind of a nebulous term. There are lots of different ways you can assess the health of the brain. But in this case, in our work, we're using this tool called cognitive function, this assessment that's a gold standard called the ADAS-Cog in that study to verify someone's level of cognitive function that really impacts across all of the different subcomponents of the brain to show that somebody is functioning or not, as the case may be in these folks with Alzheimer's. But the link between that and the immune system's functioning is just so profound. And that's another part of the uniqueness of our research that's really not like anything else in the scientific literature in showing not only these links, but then how optimizing nutrition with daily brain care can then even affect those links. So that's a very long-winded answer to talk about the Th1, Th2 on the Alzheimer's side, and I'm happy to talk about it a bit more on the MS side as well.
Yeah, let's do that. So let's go back for a second now. What's the name of that test? The 8S
The ADAS cog,
8S cut. How do you spell
yes,
that? I'm just curious for those.
ADAS
Okay.
hyphen COG.
See, I'm always
So I
looking for new
believe I
things.
believe ADAS stands for Alzheimer's Disease Assessment Study. That was an assessment that was created, I want to say,
Wow,
excuse me,
yes.
maybe about 40 years ago. It's been published probably in thousands of articles at this point, and it's not my opinion that it's the gold standard. That's what the scientific community says, especially in people with
Yeah.
any form of dementia. That is the gold standard for assessing cognitive function.
Sure. I'm just being the nerd and geek I am, consummately like, let's just take a look. Okay, here's some of the things it measures, folks, because you're gonna want to know this. For example, widely used in neuropsychological test designed to measure cognitive function, particularly in people with Alzheimer's and dementia. What it measures, memory, things like word recall, word recognition, language, praxis, ability to perform motor tasks, orientation, time and place. Sadly, there are people who come in, they don't know what year it is here.
Mm,
They actually don't know what year it is.
wow.
They don't know how old they are. They don't remember the birthday, things like that. Constructional ability, copying geometric designs, something you might do on a MOCA test. The
Right.
scoring, lower scores equal better cognitive function, higher scores is
Yes.
higher impairment. A typical person without cognitive impairment might score 0 to 5, whereas a severe case could be 35 plus out of 70. So this is very, very interesting because, uh, especially on these, yeah, and it actually says it's the gold standard outcome measure in Alzheimer's drug trials. There you
Yes.
go. So just so we know that this is considered the gold standard, which is very important because one of the things we do here is we measure. We measure as much as we can, whether it's balance, center of gravity, forward lean, side lean, back, any kind of lean, um, head position, head tilt, neck position, strength, mobility, stability, gait, cognition, and memory. Top of the list because we want to get baseline measurements so that we can measure progress down the road. So we measure, program accordingly, do it for however long, maybe it's a month, 6 weeks, 2 weeks, whatever it is, reassess, reprogram. And so that's just beside the point, but I want to let people know that data like this is so important to have because we need to be able to measure to figure out what's working, what's not working. Now, I'm just curious with the relationship between inflammation and cognitive function. Can you talk a little bit about, I mean, it would seem to me a no-brainer that with more inflammation, you're going to have, I should say, inflammation, not information,
Right.
inflammation. You could have difficulty with a lot of things. If it's physical, it's movement. If it's cognitive or in the brain, whatever. But why, how, and why does inflammation cause, let's say, many times cause diminished function cognitively or memory? Why is that?
Great question. Well, and first of all, I applaud you guys for doing a data-based assessment program in your treatment. That's wonderful because, as you said, data. If without data, you're just guessing, right? You're just shooting in the dark, wondering if what you're doing works or not. So to assess with hard data is very important.
I'll just interrupt 1 second. My friend, Dr. Brent Brookbush, told me a long time ago, probably 17, 18 years ago, if you're not assessing, you're guessing. And it's
Exactly.
true.
Great
It's
statement.
true. Yeah, we might guess well, but if, without the data,
That's
we
right.
won't be as accurate. So,
That's
okay.
right.
So what's the relationship here?
So
inflammation and yeah,
again,
declined function.
inflammation is very, it's a very, the concept of inflammation to me is very fascinating. And I think a lot of times, like if I could do, as we say, if I could do something over, I would have spent more of my time in training and education, looking at the immune system. I just find the immune system so fascinating. I mean, everything about our body is fascinating, but to me, the immune system is just such, because it's hard to put your hand on it, right? Like you see the heart, you see the liver, you see the brain, you see the eyes, you see, all these other organs, but the immune system is almost like a ghost. I mean, it's in all these different tissues, and it doesn't really have a home, so to speak. So it's just very fascinating when I was talking earlier about this link between acute and chronic inflammation and your immune system's ability to like cut that, right? To be able to like cut that off. Okay, I've repaired the damage. We've handled the infection. Now let's get back to baseline.
Mhm.
And so when that doesn't happen, when somebody transitions into this chronic inflammatory state, that's where all this unraveling occurs. So, I mean, there are lots of different theories about that. I mean, one of the things, of course, is that the longer you're exposed to these growth factors and cytokines that are constantly being secreted by different cells, then it dysregulates your tissue, right? So I think this is a big component. I don't think it's as much, actually, I think it's better understood in the MS model than it is in the Alzheimer's model. As you know, the Alzheimer's model is just such a heterogeneous mixture of all these different factors that scientists are still trying to get a grip on. But yet on the MS side, I've read some really elegant papers talking about how this chronic inflammation has a very detrimental impact on the central nervous system.
Mhm.
So when you think of the brain being, the most important component of your central nervous system, if it's been shown that all these different components of the immune, or I'm sorry, the central nervous system, whether it's the myelin sheath, whether it's your astrocytes, whether it's your gliosides, all these different, your neurons, all these different components of the central nervous system, they are being negatively affected by essentially living in this chronic inflammatory state. What does that mean? Well, that essentially means that they're not operating in a homeostasis or in a baseline environment. So they're dealing with all of these messengers, all these signals running around them, and then it just dysregulates their functioning essentially. So
Mhm.
one of the other interesting things that I read again in the MS model of this whole chronic inflammatory process is how that's actually the root of the demyelination story, because this chronic inflammation never gets stopped. And so for some reason, and this is where maybe you can help me because you deal with this a lot more than I do on a daily basis, but where does that then lead to the demyelination, of that sheath? Like, I don't
Yeah.
know. I'm not, that's a little bit beyond kind of my scope of knowledge and where I've gone down in terms of really truly understanding this. But generally speaking, more at kind of like the helicopter level view, is when you have all of these signals just constantly there, the cells they get dysregulated. So, and I'm sure this goes all the way down to the mitochondria, the endoplasmic, the reticulum, the Golgi, every single organelle in the cell is now dealing with this altered state essentially of all these signals, constantly barking at them. And then that's where all this dysregulation comes in. And then over time, I mean, I think one of the things that I'm speculating a little bit here, so I don't know if this is exactly the way it works, but imagine when we sleep and we're clearing out all of that metabolic waste, especially in the brain. And as we know that if we're not sleeping well, then insomnia and chronic sleeping problems actually elevate our risk of dementia down the road. So I can imagine in the context of inflammation, if your cells are dealing with all of these signals just constantly going off all the time, saying, "Hey, we're inflamed,"
Mhm.
send cells here, send signals here, send messengers here, send growth factors here, then it's disrupting or interrupting the body's ability to clean out all of that metabolic waste that builds up over the waking period. Then when you lie down and go to bed and allow the body to do its job, cleaning out, doing that housekeeping, but it can't fully do that because of all these inflammatory signals going on all the time. I think that's part of the story too. Again, I'm speculating just a little bit there. So if somebody has a better idea of exactly how that process works, I would love to learn it. But yes, I think, again, at a higher level, generally speaking, just because you're chronically inflamed, you have
Yeah.
all of these signals going all the time.
Mhm.
Over time, that dysregulates your cellular, basically your regular bioengineering, your regular cellular functioning gets dysregulated.
Yeah, I think it's a great response. It totally makes sense. In fact, this friend of mine, Dr. Stewart, we're such good friends, I can't remember his last name. So, oh my gosh, I can't believe I'm doing this. I need more brain food.
Yes, exactly.
He, we were teaching in Austin, Texas together years ago, and he was talking about leaky brain syndrome.
Hmm.
So let's touch on that for a second, because we know we've heard of leaky gut syndrome. Well, it blew my mind to find out we can have leaky brain syndrome from all kinds of issues like
Right.
inflammation and this and that. And the dis deregulation or disruption or dysregulation of well, brain function signals going back and forth between areas to have you do what you're supposed to do, whether it's, your heart beating right or moving or thinking.
Right.
That leaky brain syndrome, if I remember correctly, it had to do a lot with chronic inflammation.
It
It's
has to,
crazy.
right?
Oh, it's just crazy, isn't it?
So I
Okay.
think I
Mhm.
would imagine, I would again speculate a little bit what he was referring to could have been also when your leaky brain occurs, you have this degradation of the blood-brain barrier, and
Mm.
then other things cross that shouldn't be crossing, right? Like all these metabolic waste, these byproducts of metabolic waste, then they get in there in the mix, in the milieu, and then they also disrupt because they now you have like this sort of mixture of stuff that the brain is trying to get rid of this waste, but then it's going back and forth between the blood-brain barrier, and it also creates inflammation as well.
Well, sure. I mean, that's a huge deal when you get through that barrier. The things to get through need to matter. I mean, they do matter. They need to be good things. So,
Right.
well, okay, so let's segue for a minute. I want to go into the MS discussion a little bit. And the reason for that is we have some people who come here with primary progressive multiple sclerosis, which is different than your, let's say, in fact, it's the rarest form, is my understanding, of the four types. It's also my understanding there are four types of multiple sclerosis. Um, what we most of us think of when we're thinking of multiple sclerosis are lesions on the brain that can come and go, and you could be in
Right.
remission, or they can come affect one part. So, at one point in time, you're affected one way, whereas, a month later it could be different. Um, the PPMS usually affects the lower extremities, the legs, the toes, things like that. And now, please correct me if I'm wrong. My understanding and studying this is that the myelin sheath, lower lumbar through sciatic, is starting to unravel. The signals are being interrupted. And the reason I'm mentioning this is you talked about the myelin sheath. So I wonder if we could get into a little discussion there. However, you want to go down this pathway of myelin sheath, um, why it's important to have healthy myelin, and also how this can help the food, and where does inflammation and autoimmune things, where do these things play a role in the unraveling, and what can we do about it?
Great question. Well, we actually studied relapsing remitting MS patients in our study. So from a population perspective, it would be interesting to do a study with daily brain care with the folks that you're seeing in that different category. I'd love to see what the if we could get similar results that we got in our study. But we showed one of the things that's very interesting, and I'm sorry, this is a little bit off your question, but I just want to address it because this is very important for people with MS. I didn't know this prior to running the study, but people with MS, actually, the leading cause of death is not demyelination of the central nervous system. You know what it is? It's infection.
Oh, really?
It's
Whoa.
infection. So people get a UTI, they get a
Oh,
lung infection,
yeah,
they
yeah.
have a wound, and then they get septic, whatever type of infection it is. And that's actually the leading cause of mortality of people with MS. So, another one of the most amazing, beautiful characteristics of these polysaccharides is that they are highly, highly anti-infectious. So in our study, the folks with MS at baseline, get this, had 7.9 infections. I mean, that's a staggering number. And then we put them on the formula over that 12-month period. At 12 months, they had two and a half.
Wow.
So not only are we saving lives by knocking down those infections, but we are also keeping them out of the hospital, out of urgent care, out of all these other treatment facilities that's so expensive to treat these various infections. So that
Yeah,
again is like another, I mean, of course, and we don't, we're not claiming that we treat infection. That's, we're drifting kind of into the pharmacology uh, paradigm, if you will, of saying we're using nutrition to treat disease. And by the way, I always like to say this anytime somebody interviews me or I have a conversation is please never anyone say Lewis said you could use nutrition to treat disease. I never say that. That's the pharmacological paradigm of taking a chemical or a group of chemicals and then treating a symptom of a disease by altering a metabolic pathway. What we do with nutrition, as you know, just like with exercise, is we enable metabolic pathways with exercise and nutrition. And that's exactly what these polysaccharides do is providing raw materials that the genes interpret to guide our cells to function properly and then allow the body's own inherent intelligence to hopefully heal itself. So that's a
yeah,
completely different paradigm. But I always like to be very clear that I never say we're using nutrition to treat disease just because I never want the FTC sending me a warning letter saying, hey, you're talking about treating disease with nutrition. No, I'm not. I'm talking about enabling the cells to function properly as guided by our genes. Completely different. But with that said, this anti-infectious characteristic or capability that the polysaccharides has is just enormous, and it goes back to one of our original beliefs or theories. Again, it's a bit speculative just because it's so difficult to really completely wrap our hands around this, but we believe these polysaccharides are signaling mechanisms to the immune system. And because of
mhm.
all of this coded library of information that is so dense in these polysaccharides, it enables different components of the immune system to do their job the way they're supposed to.
You
So I
know,
just wanted to say that just,
mhm.
as like a little side note of information about what we showed that was so promising in the MS study, because again, folks with MS are dealing with infections all the time, and unfortunately, it's killing them at a way too high of a rate. Now,
Can
related to
you,
the
I'm sorry to interrupt. Can you go back 1 second? It is believed that the polysaccharides are what?
signaling mechanisms to the immune system.
Okay, thank you. Even though I can watch this 1,000 times after this, I have to write it down because I remember things better when I write.
No, that's
And I
okay.
think that that's a really, really, really important statement right there.
Very important.
Hmm.
So, related to the myelin sheath, and you'd asked me about that. So, something absolutely directly related to the myelin sheath functioning that we showed in our study is this little protein called epidermal growth factor,
Okay.
EGF.
Hmm.
EGF. Epidermal growth factor is a very important protein that the body utilizes to create myelin sheath. How cool is that? So, over that
Wow.
12-month period, we showed this really statistically significant increase in epidermal growth factor. I mean, Carl, that was not an expected finding. We had no idea that we would show that, but much like again findings that we're not talking about in the Alzheimer's study, it was one of those findings where it was like, wow, okay, this makes sense because at the same time we're showing all of these just dramatic improvements in quality of life. and physical functioning, we also show this really nice finding at the physiological level of this protein that gets turned on, this growth factor that gets turned on in response to taking these polysaccharides, this formula that helps these folks repair their myelin sheath. And so that in combination with we showed us a statistically significant increase in a cell called CD34 CD95,
Hmm.
and that cell happens to encode on the FAS gene, the FAS gene. And so you can look at the FAS gene as like the genetic marker, if you will, of overall immune system functioning. So you see this dramatic increase in the immune system's functioning at the genetic level, combined with this dramatic increase of EGF rebuilding the myelin sheath. It makes perfect sense why these folks were having such improvements in their quality of life and their physical functioning because of what was happening at the physiological level. Just beautiful findings. I mean, like, these were the kinds of findings that
Oh man, yeah,
you're really talking about almost like holy grail stuff because
yeah,
you couldn't actually have written it any more perfectly in terms of being able to describe what was happening and why these improvements were occurring.
yeah. That's epic. That's
Right?
one
I
word I
mean,
can think of. Yeah, it's so
truly,
significant. Yeah, so significant.
and this is why, as you and I have spoken several times offline, like the only hole in my heart that I have of my career is the fact that I basically had to leave academics because I could not get more funding to extend our research. I mean, if I had more money than I had common sense or that I knew what to do with, I would already be running, multiple clinical trials to continue expanding on what we've already discovered and shown, to continue answering more questions that would help us deal with, this horrible thing we refer to generically as neurodegeneration. But in
Yeah.
addition to, cancer and heart disease and diabetes, I mean, there are just so many other areas that Dr. McDaniel, my mentor in polysaccharides, and in this whole line of work that he and I have talked about over the years. But, it's a matter of money that we don't have, unfortunately. But there are so many cool things that we have questions we would love to answer if we had the funding to do it.
Well, let's talk about this for a minute because okay, I have a boy, how do I say this with respect? I'll just be blunt. I'll be blunt. It's true. People come in here often, or in my life often. I'm introduced to, there's this one gentleman who used to come in, he since has moved away. Every session coming in with a new supplement vitamin for me to try, and I never tried any of them. And I know he was doing his homework, and I know some of it might have been good and legit and this and that. And no judgment. I don't mean this in a disrespectful way at
Mhm.
all. At the same time, you just look at the guy and you know none of it's working. Or he's just eating the worst diet, not moving at all. And I mean, I don't know. But I've been there. I've been there where I'm almost 300 pounds fat, obese, drunk, hungover all the time. I mean, just stupid, ridiculous self-sabotage until one day I decided I had to get it together. So, whatever. I made a choice and did it. But what there seems to be, as I was just trying to say to you, is I have a lot of resistance when people come to me with something new and say you need to try this. Um, The reason I didn't resist you is because it came from Eric, and I trust Eric. So, like, I trust him with my life as far as, when he recommends something, it's going to be top notch. So, for people who, now I'm going to be asking you to promote your own thing here. That's why we're here. This is all about you, not about me. Is when people are resistant to, let's say, trying the daily brain care, what do you do? What do you say? I know most people, once they start, they're on it. And
Right.
that's it. And they just keep coming back for now years. But there are people who it's like, you need to do this because just do it. And they won't do it. How do we deal with that?
How, how do I deal with it personally?
How do we deal with it? Yeah.
I tell people that first of all, I put my name on the label. I'm
Mhm.
not trying to be deceptive. I'm not trying to be slick.
Mhm.
And this is my life's work. And I think the authenticity of my message reaches people. I mean, we have lots of examples. I mean, unfortunately, gosh, look at what happened with Peter Attia and Deepak Chopra this past week
Oh,
with
Deepak too? I didn't know about
Deepak,
that.
yes,
I knew
Deepak
about
Chopra,
Peter. Ooh.
yes, both of them had these, let's just say, not so flattering email messages back and forth with Jeffrey Epstein. So, what does that do to somebody's reputation and their credibility once something like that is exposed? I mean, for me, like, fortunately, I had no relationship with Jeffrey Epstein, so
I'm
that's never
glad,
going to,
yeah.
nothing like that's ever going to come out of the closet for me. But Carl, I'm just a very authentic person. I mean, there's nothing about what my mission is that's deceptive or that I'm trying to be something I'm not. As I like to say, daily brain care was not an idea I had one night in the shower. And then I said, wow, I can, make this product and make a living. And, if it helps people or not, who cares? I'm just trying to make
Mhm.
a buck. This is as I mentioned earlier, this is the for me, the culmination of my most important life's work. I mean, I've done lots of other things too that I'm proud of, but everything else kind of pales in comparison to what I showed in my academic career compared to this work that created daily brain care. So for me, anytime I have the opportunity, and I'm grateful again for being with you today on your show to to tell at least part of my story. I mean, again, this is just my life's work, and these polysaccharides are something that are so special and so unique. They're not like, eating an apple or getting, making a smoothie. They're just something very, very unique that I don't know beyond biochemistry. I can't explain why from aloe vera and rice bran these things are so darn effective. And I hope as my career continues unfolding that I'll eventually be able to put a better let's say bow on top of that package, if you will, to
Yeah.
explain that. But for right
Mhm.
now, you don't, I mean, nobody eats aloe vera. Most of the world eats white rice. They don't eat brown rice. So white rice has had the rice bran stripped off of it. So with daily brain care, we've taken the hard work out of, for what most people would not even want to do and put it into a formula that's convenient, that's easy to take. It's not expensive. I actually had somebody on Facebook tell me the other day, "Oh, your product's too expensive," and I'm like, "Really? Like daily brain care is a little over $1 a dose.
Yeah,
Like,
it is. Yeah.
how is that expensive? I mean, and this probably is the same kind of person that spends $12 on a latte at Starbucks or some ridiculous,
I was
uh,
just going to say exactly almost that. And
right?
I will admit I'm one of those people who spends on lattes with bloat milk, if you will,
Hey,
bloat milk, and I try to get the low sugar and all that, but I have to have it now and then.
but
But
it's
yeah,
like,
yeah, but there are those out there who, no matter what the price is, no matter what, they're always going to tank it. They'll go out and spend 70, $80 at Walmart for some other thing that has
exactly.
some fancy label that draws you in, and then you end up with kind of like circulation problems because your blood vessels
That's
are
right.
constricted, and your heart's weird, and you can't sleep at night because whatever, and you think you get something great because of the marketing. Um,
That's right.
that's Beware, folks. Just beware. Be careful
Exactly.
of where you're putting your money.
And do
I
you,
can, yeah,
and do you, I would also say anybody out there who, is maybe listening to this and still feeling skeptical, again, go to my website, drlewisnutrition.com, go to PubMed, and even,
look,
that is the gold standard for scientific information. Sorry, I said inflammation, information
yeah,
of the entire world. Any journal that is worth its salt is going to be indexed by PubMed, and all of our articles that we're referring to today are indexed on PubMed. So that is the scientific authority of the world for information related to health science. And all of that is there. I mean, it's published. Yes, I don't publish the actual formula. That is my trade secret, my
Sure.
intellectual property. That's the
Hmm.
one thing that I, keep because I can't just give that away. Then everybody's copying it. But I mean, beyond that, you can see the research, you can see the results that we've published, you can see the effects. You can take two and two together and say, hey, it worked in this study. Why can't it work for me, et cetera? And again, Carl, I'm just an open book. There's nothing about my story that I want to keep from people or that I'm trying to hide or I'm trying to be deceptive about. I'm just trying to help people. And my mission in my company is to ultimately touch at least 1 million lives. That's what I want to do. And you don't have
Yeah.
to have neurodegeneration. I take it. My mother takes it. My wife takes it. She was taking it when she was pregnant with our first child. I've been giving it to both of our children since they turned 6 months of age. So this is for everybody. If you can open your mouth and swallow, take it because these tools in
Yeah.
your toolbox are not like anything else that you're going to find. And even people that have had stroke and now can't eat, we have customers putting it in their loved ones' feeding tube. So get it into your system so that your body can utilize these incredible gifts from Mother Nature and help yourself be optimally healthy.
Well, that's okay. So I don't have any diagnosis of anything neurodegenerative. I've been taking it, and it'll be 3 years this summer. So I'm going to tell you a little thing that I do. I do it every 3 months.
Okay.
And I don't know if it's dumb, smart, whatever, but it's what I do. I have, some couple supplements I take that are, magnesium and so they're uh, spirulina and whatever.
Hmm.
And something else, I can't remember what it is. And then I have the brain care. So this is my first thing when in the morning, I go downstairs, I reach the top shelf right there, I bring it down. I got this and the creatine and some other stuff. So, anyways, I stop all of that for 1 week every 3 months. I don't take any of it.
Okay.
Now, what's interesting is like I don't notice feeling different, thinking different by not taking it. It's not like after 1 day, 2 days, 3 days, or even 7 days that I feel like, no, but I'll tell you what I noticed big time because I reintroduce things 1 day at a time. Like I'll
Hmm.
start with brain formulas first. So like on Sunday, brain formula. Immediately that day, well, I say immediate, like within an hour or something, but that same day, after taking the brain formula, but I don't add the other stuff in because I want to see how I'm affected. I had creatine the next day, spirulina the next day. But after 1 week off, and people have even commented to me, whoa, you're focused.
Mm.
So I don't notice it when I stop taking it, but I notice it when I start taking it.
Mm.
And so do
Oh, that's
it's
awesome.
it's not even me, it's other people who notice it. And I think that actually says a lot right there because I'm pretty famous for being all over the place mentally, although I'm getting better these days.
That's
In my
awesome.
and so this just it's my experiment. I've been doing it for probably over a decade where I want to see how I feel without. I want to see how I feel when I restart things. And so I think that that says a lot,
It does.
And I can tell you the times when I schedule to not take it, if I get interrupted and I have to go travel and teach somewhere, I make sure I take it and I reschedule my time off because I want to be sharp, like last week in Chiapas, we had to be super sharp because I've got another language I'm speaking and just paying attention during teaching and a lot of high intensity, high focus. So I will say, as a user of the product, that I feel really good about taking it because, oh, another thing too is all my blood work has been 100% perfect for a little over 2 years. And that's actually never happened in my entire life.
Wow.
Well, I know some of it has to do with my choices and what I eat and some other things and whatever. But I just feel not only a physical, but a mental, cognitive balance and the ability to focus is really important to me, especially as I get older. I realize the clock is ticking, and this is getting to be a pain in my rear end. Like I'm going to be 65 in a couple months. Where the heck did that time go?
Right. I know. I feel the same way.
And I got
Well,
people 70 years old, just only 70 years old, coming in here, early 70s, mid, with all kinds of dementia and things. And I am not going to be a part of that if I have any
no.
choice. So I choose this formula. I choose to exercise. I don't want those problems. If I could be
Right.
preventative, that's what I'm doing. So this is for me, this is not because of anything. It's to be preventative.
And that's a great point because a lot of times people ask, that's the question that I get probably more than anything else is, well, how does it prevent, right? Like, okay, you've shown all these effects in treatment, but how does it prevent anything? And the best answer that I give to people routinely is that, unfortunately, we cannot study humans in a prevention paradigm. There's not enough money. There are not enough people who would be willing to submit to such a long, basically lifetimes worth of testing on them to determine what actually prevents neurodegeneration or cancer or heart disease. So the best thing that we can do is look at these studies in disease models and then look at these different factors that are affected, and then we translate that to ourself. So, in other words, in the Alzheimer's study, we showed this nice CD4 to CD8 ratio improvement over time. That's your helper cells to your cytotoxic cells. That's a
Mhm.
ratio that's not important for people with Alzheimer's. That's important for all of us. And we want that ratio to be optimal for every day of our lives. And so, if we know that it works over that 12-month period in people with Alzheimer's disease, well, why in the world would it not work for you and me as well? So, that's the best way that I can kind of relate that prevention question to people is if you know these things boost your immune system, if they control chronic inflammation, if they boost your adult stem cell production, if they balance different components of your immune system, if they help you to control infections, if they improve your cognitive function, if they improve your physical function, if they improve your mood and other quality of life indicators, well, why in the world would you not take that tool and put it in your toolbox just like you have to
Yeah.
prevent bad things from happening to you down the road?
Well, yeah, that's another thing too, and it's really sad. I'm just going to be blunt about this too, is we'll have people who is something as simple as they just don't hydrate well enough. And then
Right.
what do you know? They're 80 years old and they got a UTI. And what happens during a UTI, the older we get, the more confused we get. I remember my grandmother having UTI 30 years ago, 35 years ago. She was in the hospital, and I didn't know anything about this stuff back then. I was a drummer for a living back then. So I go in, I visit her, and it's like a different person. It's like she had
Mm.
dementia overnight,
Wow.
complete confusion, in her almost 90 years old at that point. I'm like, what happened to Nana? Nana is not,
Wow.
she doesn't know anything. She doesn't know who I am. She's talking about stuff that's like 50 years ago that's not current right now. Well, this is
Mm.
UTI at its worst when it affects cognition and memory like that. Well, so that can add also to disorientation of your where you are in space. You fall down, you break a hip. I mean, there are people who get a UTI and they never come home.
That's right.
Disorientation, fall down, break a hip, whatever, and they can't move, and rehab's horrible, and they just won't even get you up and move hardly, and it's all because of dehydration. I mean, there are probably other underlying factors, but the bottom line was dehydration, urinary tract infection. But most of those people had some other neglect in their lives too, and they weren't being moving enough and eating well enough and not taking anything. No judgment. I'm just saying this is what I see. I see it constantly, and I'm trying to avoid it for help people avoid this. Yeah. So, as a proponent of your work, your product, your mission, I mean, I cannot recommend enough. Take the daily brain care Just
You, Carl.
get on there, buy it. You can buy it here at my clinic. You go to my website, carlsterling.com. There's a Dr. Lewis page on my site. You can just click through, buy it there. You can go to Dr. Lewis's site, which is Dr.
LewisNutrition.com.
drlewisnutrition.com. And I have one other question. Do you have another 5 minutes?
Sure, let's do it.
10 minutes? Okay. Now, just so you know, folks, before we got on, we had no idea what we were going to talk about. Well, we knew we'd find things to talk about. And if I open up a door here that I shouldn't for any reason, please tell me. But I am curious to know something also, because periodically you'll send me information here and there, email, Facebook, Messenger, which I appreciate, by the way. I don't always respond. I'm horrible at that, but
Oh,
I
that's
read
okay.
everything. I read everything or I watch everything. Can we talk a little bit about vaccines? No. And
Sure.
would you mind sharing your thoughts, opinions, feelings, research, um, or study of research about are there any vaccines out there we should be mindful of maybe avoiding or be careful if we take the vaccine or are there any we should be taking? I mean, there's so much coming out now about certain vaccine in relation to well, brain function
That's right.
issues. And I don't want to go down a road here that's too controversial, but I will say it seems to me that even in the world of ASD, let's just say autism,
Yes.
perhaps there have been instances where a vaccine may have caused a problem. And I'm just curious to know, in general, is there anything you want to say about the world of vaccines? I'll just start with that.
Well, I appreciate you bringing that up because, yes, for me, and especially now as a father of two young children, our daughter will be 6 in March, and our son will be 15 months in 5 days. So we have two young children, and again, full disclosure, I'm an open book. We have not injected our children with anything. They have not taken anything, and it's an interesting. Because Angie was born during COVID. And so I was the only person who could be at the hospital with Leonette. My mom couldn't come over. Her mom couldn't come over. There were no visitors during that time. So Angie was born in a way of, not having all the family around. And the neonatologist, both of our children were delivered by C-section, not naturally. But when Leonette stayed in recovery and I went with Angie to the nursery, and I met the neonatologist there, and I had already done all of my homework on the vitamin K shot. I had looked at the data comparing children who took it versus children who didn't, and their risk of bleeding disorder was so ridiculously small. It was not even worth, in my opinion, it's not even worth a conversation. And hepatitis B, I mean, thankfully, with RFK taking over HHS, they've gotten rid of that recommendation for a baby. The very first day in the world, you give a hepatitis B shot. That never made any sense to me unless the woman delivering the baby had a history of hepatitis B. Why in the world would you inject a baby that just came into the world for a couple of hours that vaccine? It just never made any sense to me. And um, so I ended up having like basically a 30-minute argument with this guy. He just would not take no for an answer. He kept trying to tell me I was making a mistake, blah, blah, blah. And I'm like, dude, you can tell me anything you want. I've read the data. I'm comfortable. We are comfortable with our decision to not inject her with anything. The only thing that we would give you permission to do on her first day of life and until we leave to go home is if unfortunately she has some sort of life-threatening situation where she has to be injected with an anesthetic or something to save her. But I said, other than that, forget it. And then when Philip was born, it was same hospital but totally different staff. And the neonatologist there was a lady who was very sweet. And I mean, she didn't even ask us actually if we were doing it because we'd already signed all the paperwork. So she read it. But Carl, I read I'm guessing you at least read a headline or two of it. It's been, very widespreadly promoted over the last few months. This study through the Henry Ford medical system in Michigan, where over, I don't remember how many years, but it was over, I think, 18,000 children that looked at the differences between children that had been vaccinated with, I guess, the regular schedule, the regular recommendation, versus children that had not. Oh my God. The prevalences of all these different things you mentioned, autism, all these other developmental issues, asthma, allergies. I mean, just this entire list of all these different problems were like hundreds of percentage points higher in the children that had taken the vaccines versus the children who had not. I mean, just ridiculous
Hmm.
differences. And then the lead investigator, was interviewed by Del Bigtree, the guy that does
Yeah.
the High Wire shows.
Hmm.
And this guy said he was so scared to publish this information because he knew that his career would be over if he published it. I mean, what kind
Hmm.
of environment do we live in where you're conducting science and then at the end of your study you feel like you've got something so powerful that you can't publish it because you're afraid your career's over. That's not
Yeah, it's
that
pretty
should not be
sad.
the United States of America. And
No, no, no.
and then going all the way back to 1986 when President Reagan signed into law, I forget the name of the act, basically giving every vaccine manufacturer total legal and financial immunity. So, we've heard this term safe and effective thrown around by, the vaccinologists or the pro-vax people, whatever you want to call these people. If they're safe and effective, why did the government give these manufacturers blanket immunity? Why can they not be sued for creating a product that could damage and kill people? That's the only, to my knowledge, that's the only industry that has that kind of blanket immunity. You're not going to find that for the automakers. You're not going to find that for any other kind of consumer good or product where somebody could be injured or killed using their products. So, why in the world do we give these companies blanket immunity and keep them protected? If they're safe and effective, that law needs to be abolished.
I would agree 100%. So I'm only asking a question without inferring any opinion for those listening. And the reason why is because I don't know anything. I've never done research on this. I only have hearsay. So let's take it just a step further. One of the vaccines that is given to almost everyone is the MMR, measles, mumps,
Yeah.
rubella. How do you feel about that one?
Again, I just in terms of this is for my own personal experience, we're not giving these to our children. These things actually, if you look at talking about data, so there's a series of DVDs, I forget if it's seven or eight, produced by Ty Bollinger and his wife, I think, I forget her name, but they actually had a vaccine injured child and it spurred them to get into the weeds of the research, and then they created this series. It's called The Truth About Vaccines. And Leonette and I watched it. I mean, I was already who I am as I'm speaking, but this was just like taking it to the next level in terms of, from a more scientific base. And so actually, when we're exposed to some of these viruses or bacteria earlier in life, what this actually does is build our immune system even better because it's dealing with something that it has to recognize, deal with it, and then move on from it. And so you're actually creating a more resilient, more effective immune system that actually helps you, guess what? Prevent having more cancers later in life. So if you get exposed to something like measles, I mean, somebody on Facebook, a friend of mine, put an image up of an old Flintstones cartoon where the Flintstones The writers of Flintstones made an episode about the measles. The Brady Bunch, God love the Brady Bunch. There was an episode about the measles. I mean, this is just a transient infection. People call the measles a disease. It's not a disease, it's an infection. It's a transient infection that people get. Nobody, almost no, I shouldn't say nobody, almost nobody dies from it. Why are we now living in this fear era where, oh my God, we can't, be exposed to this because it's going to kill us? I mean, that's not, in the case of measles, that is not at all true. How did we go from having it in a cartoon and a sitcom to now creating all of this fear mongering around it to just create all of this sensationalism about something that doesn't even almost every time kill people? So I don't feel like getting the measles is any kind of death sentence. It's just a transient infection that you will get. You'll get over it in a few days, and you won't even remember you've had it. So I don't know. To me, Carl, there's just since COVID, there has been so much fear mongering and propaganda. And if you look at all this stuff, what were we told? Masking, you mentioned messenger RNA injections. Oh, by the way, CDC had to change the definition of a vaccine to include that type of treatment or intervention because, by definition, historically, those things are not vaccines. They're something that's a drug in a completely different category, but they changed the definition to accommodate it, I guess, for this blanket immunity that they can enjoy. But masking, social distancing, all this other nonsense that we were, again, just so much propaganda that was thrown our way over that couple of year period that just scared the crap out of so many people. And then, years later, what have we found out? Well, if you wear a mask all the time, you're actually rebreathing too much carbon dioxide. You're getting bacteria building up in that mask. That's garbage. You shouldn't have been doing that. Social distancing, 6 feet. That was a number completely arbitrarily pulled out of somebody's butt. There was no science done around this so-called 6 foot marker. And, oh, you can't go see your parents or your grandparents. You've got to stay in your home, and it can only be so many people in a home. I mean, all this stuff, we're going to 10, 50 years now, if humans are still here, we're going to look back at that 2020 to 22 period, and we're going to say, oh my goodness, the stupidity of the average person during that time was like off the chart. It just
Well, I have to add,
mind-boggling.
I, I have to add a couple things there. First
Please.
of all, I have a very dear friend who lives in Mexico. She's from Guatemala. Her name's Isabella. We're going to talk about her in a minute. But Isabella, if you see this, I want to let you know that I'm drinking the Guatemalan coffee you gave me. And Dr. Lewis, with all due respect, I don't care if coffee's good or bad for me. I'm drinking it.
Go for it, brother.
There's nothing in it other than just pure coffee. And Isabella, this is so delicious. Thank you. Thank you, my friend. So with that, I was with Isabella last week. We were talking and she mentioned something about the pandemic. Did you hear what I said?
I did.
I loved it. I couldn't believe it.
I did too.
The pandemic. And Isabella, thank you for that. So now I have to segue, and I don't want to get in trouble here. I don't think I will. I have a son who's an MD, so I won't even say his name, who, when he was at residency Atlanta, a friend of his at the CDC, right around the very, very beginning of COVID, said, Nick, you got to come over here and see this. It's the
Mm.
COVID molecule or whatever.
Mm.
So I confirmed this when I saw him last December. We were talking, and because I forget what the name of his degree is, but it's something really, I don't know all the words. They're too big for me. But when it comes down to looking at that COVID-19 under a microscope, according to him, it was very, absolutely, definitely a splice job
Yes,
engineered, hence pandemic. Okay,
exactly.
so now that we got that out of the way, and I realize we're actually touching on some very, very potentially controversial issues for people because, and I am going to stay neutral right here because I believe it's probably the best thing for me. I consider you to be not only a good friend, but also an expert. You've done this research. You're published. When we started 3 years ago, you were 162 papers. Now it's 180, 190. I mean, this is a lot of work you're doing. That's amazing. And while it may not be necessarily related to COVID or any vaccines or anything, the 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 thing is you have researched these things, so you have your opinion based on your knowledge, your research. And so I think it's really important to bring these things out and talk about them so people can make more of an informed decision, if you will. I think it's so important. And now I could have another expert on who, well, I did have one on actually, and I also won't say his name, but he's a neurologist who is vaccine all the way, baby. And he'll give you every reason why.
Hmm.
I'm a podcast host and I wear this shirt with my name on it, and that's it. So the idea, though, is I think it's important for, as my friend Isabella and others I know who are on both side, either side of the coin, no vax or vax, it's important to do your homework and make your decisions based on what you feel is
Exactly.
best. And so I really, really want to say thank you for sharing your knowledge, opinions, and thoughts on this because I really put you on the spot. I wasn't intending to do that, but I had a feeling you'd
Okay.
probably be happy to answer just because I know you well enough. So thank you for that. My last question, though, in relation to vaccines, at least until I come up with another one. Um, if we if we look at, again, I'm going neutral. Is there anything that does show in any way, shape, or form that any vaccine or anything to do with vaccines that people have accepted into their bodies can be a catalyst to cause any type of autism or anything on the ASD spectrum? That's my question.
And and again, Carl, thank you for posing these questions because I agree with you. It is important. I mean, I'm not a vaccinologist. I'm not somebody that's studied vaccines or worked on vaccines for a living. But as you said, I do my homework and I read the information as much as I can, and then make decisions based on that. So it's very apropos you're asking me this because, and I'll share with you the link to an article that I just read yesterday. So, what is one of the most commonly used adjuvants or immunostimulants in almost all vaccines? Aluminum. Aluminum is put into all of these shots
That's a
to
biggie.
cause the immune system to go, oh my God, what do I do with this? And so, what is aluminum? Well, it's a heavy metal. What else is aluminum? It is a friggin' neurotoxin.
Hmm. Yeah.
If you swallow aluminum, you're supposed to call your local toxin poison control hotline and
Hmm.
say, hey, I just swallowed some aluminum. What should I do about it? Why in God's name, why on God's green earth do we classify this material that if we swallow it, we're supposed to call poison control, but we can inject this into our babies, into our young children, into our elderly with flu shots? All these vaccines have aluminum as an adjuvant or as an immunostimulant. That stuff is then going right into the body, crossing the blood-brain barrier, and doing God knows what to you. So the autism question, I mean, to me, no brainer, no pun intended. This article lays it out very clearly that the use of aluminum historically in all these vaccines, starting at day one, is a significant driver in why we went from, I think it's like one in 30 or 40,000 children in 1960 to now it's what, like one in 30?
Yeah.
One in 20. I mean, it's a crazy change in a 60-year period, an absolutely ridiculous change. And the main driver in all that is that when, I mean, I'm a few years younger than you, but when you look at when people were born in our era, And the vaccine schedule back then, I mean, it was two or three, right? Like it was
Yeah.
literally just a few shots. And now it's up until what RFK and his administration has changed, which again, I don't know how much this is actually taking an effect yet. But I think the last number I read prior to him taking over HHS was like 86.
Wow.
86.
Oh my gosh. No, I
The
didn't know.
most out of control number of the entire world.
Hmm.
And we wonder why the United States has like is rated or ranked as like 33rd or 35th on infant mortality. This thing that we refer to as SIDS, sudden infant death
Hmm.
syndrome. What in the world is that? We are the wealthiest country in the history of mankind.
Hmm.
Yes, we still have poverty, but our country far exceeds any other country's economic, financial, whatever power. There is
Hmm.
no excuse why the United States should be ranked 33rd, 34th, whatever that number is right now. Even some of these third world countries are better ranked than us for infant mortality. To
True.
me, this is all about over medicating, over vaccinating our children. When a baby goes from being alive to dead from one day to the next, and people are not saying, "Well, wait a minute, how many shots was that child given in the last couple of days or the last week or whatever?" We do unfortunately not a very good job of autopsying or really trying to dig into the details of why somebody dies. At least that's been the case in my family. I don't know about yours, but I mean, this sudden death, the SID syndrome to me is like, again, it's a no-brainer. These babies are being filled up with all of these shots and it overloads the immune system and then they die. But yet nobody's been asking these kind of questions until RFK took over. And to me, I mean, I'm not a big fan of what they just did with the dietary guidelines, and that's a topic for another conversation if you'd like to have. But
Oh, sure. We should do this again, man, because that they turned everything upside down. That was weird.
they did.
That was
And
weird.
the whole thing with red meat and dairy. I mean, as a 27-year vegetarian, I'm not on board with all that. But I will say that, just asking the questions about vaccine and him being crucified for that. That to me is so tragic and so pathetic. If our nation, if our country, not our nation, if our population was healthy, if we were the gold standard for health, and then he was asking these kind of questions, you could kind of say, well, wait a minute, dude, we're already the healthiest population in the world. Why are you asking these hard questions? No, we're
Hmm.
not even close to the healthiest population in the world. So the idea that you can't question the dogma, question the medical establishment, question big pharma, I mean, all these questions around why no placebo-controlled trials are ever conducted with vaccines, why the outcome of a vaccine trial is, like 3 days to maybe 6 months. They never look at these children over a period of years, like this Henry Ford study that was recently conducted. So, there are so many great questions that RFK has raised about what in the world we're doing to our children, our most precious resource, by the way. And yet he's being crucified just for asking questions. Fortunately, he didn't care, and he's been, full steam ahead. And now they're actually putting money behind running some trials to get a better grip on safety and this whole notion of efficacy, which I'm going to find out. I think we'll find out down the road is much more limited than what the pro-vaccine people think it is.
Hmm.
But I mean, we are, our children are so sick, just like the adults in our country are, and we need to get the answers to why. And it's just not acceptable to me that we are such a wealthy country, and yet we have so many sick children and adults.
Yeah. Well,
And I know
I,
that's a whole
I,
nother that's a
we
whole
we
different
gotta do
conversation.
we gotta do part two, three, four, five, and infinite parts because
Yes,
yeah, I mean, I could go down a lot of pathways right now, so I'll go down
yes.
one just very briefly. For example, last I checked, and I could be wrong because I didn't check today, ibogaine is not available here in the United States. I don't know if you're familiar with ibogaine.
I've heard of it.
So ibogaine is used. I
Yeah.
just came from Mexico. I was there 15 days. I had 4 days before that. I was in Mexico again for 11 days. So I've been 26 days this year, and what's today, the 10th? I've been in Mexico more days this year than I've been in the United States more days this year. So that's because we're setting up a clinic there, and more clinics coming within a big hospital system there, which I'm very excited about. What I find is very interesting is, of course, Mexico has its problems, it has its poverty, it has its um, lack. It also has a lot of progressive neurology. Like you go to a neurologist there in one of the big cities, you're going to probably get some really great care. We have people who come here to my clinic who have the financial means to be able to go to Mexico to get a treatment that they can't get here, do better, come back, live better. Some of it's stem cell related, some of it's other treatments brain wise through electronic this and that. But another one is, for example, ibogaine. I don't know why, and I could be wrong. I should have looked this up, but I didn't know I was going to talk about it. So go look it up for yourself. IBO gain, GAIN, and maybe an E on the end. And you can find out if it's approved by the FDA. If it is, great. If it's not, well, it would probably not surprise me because it's something that's been, of course, it comes with its risks and its side effects, but by and large, as they say, and my grandfather used to say that all the time, it's been a very effective medication to help with the delivery of dopamine as a neurotransmitter to help people move better, react better, reduce fall risk, um, improve fine motor skills, improve coordination, and just live better with Parkinson's and other dopamine related disorders, MSA, PSP, and the other one I can't remember. But that's just a little side remark, not to be on the negative, but to be realistic and saying that we have all the money, we have wealth, great wealth in this country. In particular, so pharmaceuticals and insurance companies have great wealth, and there's a lot of control exercise there, and lobbyists and this and things going in where, the PONS device, PONS, I believe, or
Mhm.
PONZ, which if you look at the book called The Brain That Changes Itself by Norman Doidge, an MD out of Toronto, or The Brain's Way of Healing, his follow-up book, which is at least 10 years old. They're talking about the pons, PONS or PONZ, because it has to do with the pons area of the brain, as a device used in Canada now. In fact, I know Dr. Ryan Scott in Markham, just northeast of Toronto, where I was teaching at his clinic a few years ago. They're using the pons up there. They're getting spectacular results because of the way the gold leads go under the tongue, the electricity, the frequency delivered through the gold leads and the tongue, bottom of the tongue, right to the brain, the
Mhm.
cranial nerves that are attached. And what it's doing for people with Parkinson's is astoundingly good,
Wow.
where we cannot get the FDA to approve it here. And my guess is throw me in jail, sue me, whatever, I don't care. I get three free, if I go to jail, I get three free meals a day, right? Is control. Because once you're in the
Right.
system here, in the pharmaceutical system, and you're taking a medication, they want you to take it forever.
That's right.
Don't no, don't cure it. Just nurse it until you die. It's like that slowly managed death. And that sounds horribly morbid, but that's what the real legit researchers, authors, practitioners, they're talking about this because it is like a death spiral, but it's a managed one where they make a lot of money and you can die slower.
That's right.
Why get
I
better and
to-
cure yourself? And I'm so fed up with it. I love when I go to Mexico, I see people getting better because if they had the financial means, and yeah, that can be a problem. Okay, there's more poverty. I get it. But on the upshot, there's all the people doing well because they have the resources and they have the neurologists who are more progressive thinking. And nobody wants to believe me when I talk about, what do you mean they're backwards? No, they're not backwards. They're ahead of us in many areas, especially physical therapy too. through the roof ahead of us.
That's wonderful.
And that's why I focus there, my friend. We're going to get Dr. Lewis into Mexico.
Yes.
You might need some Espanol on your label soon. That'd be
Yes.
great.
That would be wonderful. I'd welcome that.
Yeah, we'll get you there. So, well, I mentioned maybe stopping a little after 12, and it is a little
Oh,
after
wow.
12, and I'm totally cool with this, man.
Wow.
Uh,
It's going on 1 o'clock. That's
I
wonderful.
I probably should wrap it up because we got to take care of some things here before a couple of people leave and pay somebody
Yes.
who's probably waiting for her money. So, so in any case, folks, I want to say go to carlsterling.com. That's Carl with a K. Go to the Dr. Lewis page and just check it out. Click through right to
Yes,
his site and start taking it.
absolutely.
Just do it. Do it from preventative means. I would say that just about anybody can afford this. And if you can't, then you can't. I get it. Not everybody can. But if you're spending money on a pack of cigarettes or you're spending money on alcohol, I'm not judging you, but cut down on either one or both and just get some of this. Or
That's
the
right.
lattes, the excessive lattes. Well, I could be a little guilty there, but still get it, try it. There's nothing else like it on the market, and that's why. And I get around. I mean, I've been to 30 some countries in the world. I'm no genius. I'm no rocket scientist, but I have been around and I've seen so much. This is the stuff that does it for our people here, and nobody is unhappy, and people come back for more. So get it. And also, Dr. Lewis, thank you for being with me again.
Thank you, Carl, for having me. It's always a pleasure. It's great to see you and hear your voice, and I'm always grateful for the opportunity to spend time with you. So I look forward to our next conversation.
Likewise. And hang on with me when I stop
Yes,
recording. Just hang for a minute. For the people who are watching and listening, I also appreciate you tuning in because without you, we wouldn't be doing this. But our followership has grown tremendously, and I really am grateful for that because we're always trying to bring you the best, most accurate information. And again, when we talk about vaccines today, do your own homework and make your own decision.
exactly.
I'm just a mediator. Dr. Lewis has his set of research, knowledge, experience, and opinions. That's him. You may agree, you may not, but at least you know now. Now go check out other people, see what you think, make your own informed decision as you would with anything in life. Talk to your doctor, maybe. I mean, I have to say that probably, even though I'm not a doctor, but you know, um, that's our goal is to bring good information and help you to live longer, live a healthier health span within your lifespan. That's the goal. Thanks everybody for watching and listening. Thanks, Dr. Lewis.
Thank you, Carl.
We'll see you all soon. Take care and have a great day.